blood, sweat, tears. This may sound like a cheesy action movie, but in reality, this is part of nursing. While this is a very small and minor part of nursing, there are many reasons why nursing is one of the best careers to ever go into. The versatility, the feeling of accomplishment that you actually work hard every day and you do something that's very important. Not to mention you get to wear comfy scrubs like this, which is practically like pajamas. And nursing is kind of like being in the mafia. You have a secret kind of society of wards. I mean, how many patients or people will actually understand that a patient is going into hyperglycemia shock and we need to start a insulin IV drip on them in the right AC with the 18 gauge and start the 50 as well as give them glucagon. It's kind of like being in your own secret society where only medical professionals or even nurses really understand what you're saying. I think that's just one of the amazing parts about being in the medical field. But versatility is probably what I would say I love the most. When you're in the medical field as nurses, I currently work as a CMA and I work with a lot of array of nurses, from travel nurses to float pool nurses. Nursing is not just about the blood, sweat, and tears and vomit. People look at that and think nursing is just, that's what nursing is. How do you deal with all that poop? How do you deal with all of that? But nursing is a lot more than that. You can work in a triage nurse, you can work in a float pool. Maybe you like to travel, or you like to be like me, where you like to work in different areas, and you're not like stuck in one place or committed to being in a place. Well, then you can float. You can work in cardiology one day, you can work in oncology the next day. Or maybe you want to do a little travel and get paid for it. Hey, you can work for a couple of months in California, then you can work a couple of months in Los Angeles is California. But you can work in New York. Heck, if you want to, a lot of places even hire you in other countries like South America or Brazil. Brazil is part of South America, so guess what? You can go to both places or all places in South America. It's just a matter of what do you want to do. And maybe just the medical part isn't what you want. Maybe you always wanted to kind of be more like a doctor. If you go back to school and get your master's, you can be a nurse practitioner. You can have that fancy white coat you see all these nice little doctors running around with. So when it comes to nursing, the versatility, there's endless possibilities in nursing. Along with possibilities, you also have a lot of options in what you do and how rewarding it is. Some people work in the ED, some people work in oncology, some people work in triage, some people work at home. No matter where you work at, you know you're always going to be comfortable because we get to wear these scrubs. Working in scrubs is practically like working in pajamas, I say. A lot of other places you wear the tie, you wear the suit, you wear this nice tight fit clothing that's just, it's just too compact. But with nursing, you get to wear scrubs, which is pretty much pajamas. And I know I like to be comfortable. If I'm going to work 8 hours, 12 hours, who wouldn't want to be comfortable? You have the option between pajamas or you have the option between dress clothes. If I had to choose, I would definitely choose pajamas any day of the week. And speaking of just scrubs, wearing scrubs gets you so much recognition. When you're in the store, when you're walking about, people will always stop and ask me, hey, you work in the hospital, the job must be really tough. Not necessarily, but it's not like being a police officer or military where some people will, thank you for your service. But I know everything that I do is for a reason, and a lot of people and patients appreciate it. And you get a lot of recognitions because a lot of people want to know, like, how tough is your job, how to get into your job. It's just, nursing is just such a great field because, yeah, you're not the boss of all bosses. I don't arrest people, but I do save people's lives. You do save people's life. And I can go home every day knowing that I actually do that. It's just a part of nursing, is going home knowing that you helped somebody, that you changed somebody's life today. I mean, who want to have that just amazing feeling that I went home, I stopped this person from being in cardiac arrest, or heck, I just helped this patient find a way around the hospital because, hey, hospitals are practically acres big. This is what nursing is about, and this is why nursing is one of the best careers to ever be into. It's not just about the clothing, the comfortable pajamas. It's not about being able to work wherever you want to. It's about, at the end of the day, going home, having a great job, a great feeling, and being able to say, hey, I did something. I impacted somebody's life. And as they say, once a nurse, always a nurse. It's kind of like being in the mafia. You can never get out. Even when you're 70 years old, you will always remember what you learned.